Hey, my name's Andrew Kuykendall from Moffitt Cancer Center, and just got done presenting phase 2 data on canakinumab in myelofibrosis. This is a clinical trial that's quite close to my heart, something that we developed and ran through the MPN Research Consortium, which is something that Moffitt partners with several other centers that have expertise in myeloproliferative neoplasm. So we were looking at an agent called canakinumab, which is an IL-1 beta inhibitor, which is actually approved for some rare inflammatory diseases and has shown benefit in reducing cardiovascular event outcomes in high-risk patients. But we thought it had specific potential in myelofibrosis, and so we ran a study where we enrolled patients who had myelofibrosis, had usually previously been on a therapy or two in the past, but still had a need for treatment, and put them on this well-tolerated subcutaneous injectable medication given once every 21 days, treated them for 8 cycles. And what we saw at the end of this part 1 portion of it, which is the single agent portion of the trial, is patients actually had a tendency to feel better. So we had the symptom improvement that was seen in a significant number of patients. Over 50% of patients had at least an improvement of some degree. 3 patients had actually met criteria for having a symptom response, or a 50% improvement. So certainly saw some nice anti-inflammatory responses, some symptom improvements, and overall patients who had low blood counts, those remained quite similar. They actually went up a little bit, so some beneficial impact on cytopenias as well. Unfortunately, we did see spleen volume growth on this agent, which from the preclinical data was pretty predictable. We know that it doesn't impact splenomegaly that significantly. So we actually have amended the study to really go to a part 2, where we're now adding canakinumab on to patients that are already on a JAK inhibitor, where the JAK inhibitor is going to do the bulk of the work in controlling the spleen, but the canakinumab can then help with some of the underlying disease characteristics as well as symptoms and maybe some cytopenias as well. So got to present that data, really nicely received, and certainly excited to go to part 2 of that study as we move forward. Thanks so much.